'cause I just can't get you out of my head. Fight the connection, but the emotion keeps on pulling me in. Try to resist you until I hear you.
Hi guys, you're welcome back to another session with me, Grace Williams. Today's health education is on a condition that affects only women, and it is the leading cause of death amongst women worldwide. So I saw the need to bring out the education for everybody to be well informed. My topic for today is cervical cancer. But before I go into cervical cancer, let us know what cancer in general is. Cancer is an uncontrolled growth of abnormal cells in any part of the body. And cervical cancer is a type of cancer that occurs in the cervix, that is the lower part of the uterus that connects to the vagina. This kind of cancer is caused by a virus known as the human papillomavirus, specifically 16 and 18. There are so many strains of the human papillomavirus, but it is the 16 and 18 that cause cervical cancer. The cervix has a role to play in the female reproductive organ. One, it helps the flow of menstrual blood from the uterus into the vagina, and it also directs the sperm during sexual intercourse. Now to the risk factors. Which people are at risk of developing cervical cancer? Every woman, every lady is at risk of developing cervical cancer, but there are other risk factors that we need to know. One, it is hereditary. If you have someone in your family who has had cervical cancer before, then you should know you're at risk of developing this. If you have multiple sexual partners, if you're someone who starts having sex at an early stage, then you should know you're at risk of developing it. If you smoke, have a weakened immune system, if you have any of the sexually transmitted diseases, you are all at risk of developing it. And most importantly, if you've been on long-term use of oral contraceptives for as long as 5 years and above, you should know you're at risk of developing this condition. Very important. So please take note. Now to the signs and symptoms. What are you going to show? What are you going to portray to make you know that you have this condition? First off, there will be pain during sex. There will be abnormal vaginal discharge, which comes with a very foul odor. There is also bleeding between periods. There is even bleeding after menopause. There is fatigue. There will be pelvic and back pain. There is also loss of appetite. There is leg pain and all. The symptoms are many. It goes on and on and on. Now to the prevention, which is my main focus. The prevention of cervical cancer, we have something called the pap smear and HPV testing. For the pap smear, you go to any reproductive health center, you tell them you want to do the pap smear. We take the vaginal fluid and examine it. It is not painful, it is just uncomfortable, just a little bit uncomfortable. But apart from that, it is not painful at all. So I encourage every lady to go to any reproductive health center. I know of Mary Stopes Ghana, which does the pap smear. So you can go there and do it, and they'll gladly do it for you. Then from there you do the HPV testing. Apart from these testing, we have other practices that you as an individual you should do to prevent yourself from getting it. First off, you should practice safe sex. Avoid multiple sexual partners and use protection when having sex. Avoid smoking. Make sure you avoid smoking, and then make sure you stop having sex at an early age. It is not good for you at all because you are putting yourself at risk. Now to the treatment. There are so many treatments that we do, but the treatment depends on the stage of the cancer, the age of the individual, and then the overall health of the woman. So yes, we have the surgeries that we do. That is the hysterectomy. Hysterectomy is removal of the uterus. So you can imagine if you're a young lady who has cervical cancer, which has gone to that stage where your uterus has to be removed, then you should know you can't give birth. So please treat this very, very seriously. It's very important. Also, we have the chemotherapy that we do where we use chemicals to kill the cells. And then there are other treatments that we do. But my main focus is on the prevention. Go and do the pap smear at any reproductive health center. Even during the cervical cancer awareness month, there are a lot of organizations that do the pap smear screening for free. You can take advantage of that and do it. So yes, this is the end of the education I have for you today. I hope you learned something from it and then you practice it also. Thank you for your time and see you in another video. Bye.